Well, they are injuries that are common for tennis players and golfers, but athletes aren't the only ones who suffer from conditions involving everything from their fingers to their shoulders. Please welcome back to the show Dr. Gary Kitay. He is with the Jacksonville Orthopedic Institute. Dr. Kitay, it's so good to see you. So let's start off with the hand. What are some of the common injuries, or what are the common problems that you see patients coming into your office needing help with?
Well, there's a wide assortment of problems that people come to the office with, from fractures to arthritis, but definitely the most common is a condition called carpal tunnel syndrome. And that's a condition where you can get pain, weakness, and numbness from one nerve that is squeezed in this portion here of the wrist, and it can lead to pain, numbness, awakening from sleep, and it happens to 5 out of every 100 people in the country. 5
out of every 100. So what are some of the treatment options for those people who then are suffering from carpal tunnel syndrome?
Well, the first thing we try is activity modification. Often that involves using a splint. Often that involves changing some of the activities that lead to this problem. At night, people can often awaken with a problem, and a lot of my patients say they have to wake up and shake their hands free to try and feel better, and wearing a splint can help with that.
Will it ultimately then cure something like carpal tunnel syndrome, or is this a condition that you have to then deal with throughout the rest of your life?
Well, the majority of people are cured with conservative treatment, but unfortunately some are not. And that's when we got to start talking about surgery. And when we talk about surgery, we try and get into the least invasive form of surgery, and that's what I practice, which is with a endoscopic carpal tunnel release. So if you have to do the surgery, using the smallest incision possible to have the least amount of pain and quickest recovery.
Should we come and see you, the sooner the better, if we're having problems that we think are associated with carpal tunnel syndrome? If this is something that we wait to seek treatment, is it more likely then that we could possibly need surgery?
That's a great point, Casey, because sometimes people do wait too long, and you can sometimes even get permanent nerve damage, so that this numbness and pain never goes away. But for the most part, people come in when they start having problems sleeping.
Yeah.
So if you start having numbness occasion during the day, trying to avoid those activities, using the vibrating tools less, wearing the splint. But if it's something that you just can't cure on your own with those simple modifications, then it is time to come in.
Yeah, if you're waking up in the middle of the night trying to shake out your hands, you probably know that this is a problem that needs to see professional help. All right, let's talk about the elbow, because you specifically work on the upper extremities. So what are some of the common problems that you see people coming in with their elbow?
Well, the most common is tendon overuse injuries, what we call epicondylitis, but most people know as tennis elbow when it's pain on this side of the elbow, or golfer's elbow when it's pain on this side.
Oh, I didn't know that. So tennis is on the outside and that golfers are on the inside.
It is.
Okay.
But most people that get these conditions don't play tennis or golf. It's just from overuse.
Okay.
That's a very common one. Arthritis that leads to pain and stiffness. We talked about carpal tunnel syndrome. There's a condition called cubital tunnel syndrome, and that's where a nerve is pinched here, and that causes pain numbness to these two fingers.
How is something then like that treated? I'm sure that people out there probably are taking acetaminophen or ibuprofen or something to help dull the pain. But at what point in time when we come and see you, what do you do then to help relieve that pain?
Well, of course, as for almost all conditions, we start conservative. We start with, there's splinting for the elbow as well. There's anti-inflammatory medications. But if people aren't getting better, we do get nerve testing to see how bad the condition is, and sometimes you have to relieve the pressure on the nerve with once again, a minimally invasive procedure.
Why is splinting help? Is it because to help heal it, you need to immobilize the joint or the area that's affected? Does that help the healing process?
Yes, absolutely. But the issue with carpal and cubital tunnel syndrome is they're both what we call compressive disorders, where the nerve is being essentially choked and strangled, and that the pressure on the nerve occurs more with certain positions. So with the wrist, when we sleep like this in more of a fetal position, getting it out of that position helps. And with the elbow, it also puts more pressure when it's flexed, so we need to keep that elbow extended.
All right, let's talk about the shoulder. This is another area that a lot of people have. I know that I have someone very close to me who went through the labrum surgery.
Very common.
So yes, is that one of the common conditions that you see for having shoulder issues?
Right. Labrum injuries, absolutely, but even more common than that is rotator cuff injuries. And the rotator cuff is a set of 4 muscles that surround the ball and socket of the shoulder and keep essentially the ball centered within the socket. It's a shallow socket, and if those muscles aren't effective, working properly, the ball can kind of start shifting out of the socket, causing a lot of pain, also at night, and making it difficult to perform your normal activities, especially overhead activities.
That's interesting that in each one of these cases you're saying if you're waking up at night and you're feeling this pain, that's a good indicator that you need to come in and do something about it.
Agreed.
Does this require surgery then, the rotator cuff?
Thankfully, usually not. Usually, therapy is very important, and thankfully at JOI we have fantastic therapists to help with almost revitalizing the muscles of the rotator cuff. There's activity modification, sometimes steroid injections, but when there are complete tears that don't have a chance to heal, there is the surgical option that works very well for most people.
All right, moral of the story is if you're experiencing pain, waking up at the middle of the night, get in sooner rather than later. Better be safe than sorry. All
Agreed.
right, Dr. Kitay, it's so good to see you, sir. Thank you so much for coming in. We appreciate your expertise. And we'd like to thank the Jacksonville Orthopedic Institute, of course, for coming on and sponsoring this. And for more information and to find an office near you, you can visit joi.net. You can also call 904-JOI-2000, and you can also ask specifically for Dr. Kitay.